Respiratory syncytial virus, or RSV, is the leading cause of infant hospitalizations in Canada. Dr. Cora Constantinescu, a pediatric infectious diseases specialist, is here to help explain why RSV is so serious for infants and what parents should know about protection options. Good morning, Dr. Cora. Thanks for joining us this morning.
Good morning. Thanks for having me.
So for parents who may have heard of RSV, but they don't know much about it, what is it and why is it such a concern for babies?
Yeah, so it's a super common respiratory virus. We say that by the age of 2 to 3, essentially all children have been exposed and probably had an infection with RSV. But for babies, it's a bigger deal because they've not seen this virus before. Their immune system is still developing. They're small, so they've got small airways, small chests. And this is why we see that the burden of hospitalization, especially those babies ending up in ICU, are among the younger ones. So under 1 year of age, and then it gets worse under 6 months of age. The younger the baby is in that season, the higher the risk of severity.
Now, what can parents do right now to help protect their baby during this second wave of RSV season?
So we say good infection prevention and control. So you want to keep any adult or older child who may be sick away from the baby as much as possible. Good hand hygiene, but also for the first time this season, there are 2 available products for prevention of RSV. One is an monoclonal antibody, an immunization product that can be given to the baby at birth. So it can be given in the first few days of life to protect them against RSV for the RSV season. And then the other one is a vaccine that can be given to the pregnant mom in that 3rd trimester, between 32 and 36 weeks, again, to protect the baby in the first few months through the RSV season. Both of these products are available, but they currently would have to be paid out of pocket in Alberta for parents. But they are available, so it is worthwhile talking to a healthcare provider, because we do have products now that can prevent this disease and severity of this disease in babies.
So some parents may hear the words immunization or vaccine and have questions. What should they know about the safety and use of these RSV protection options?
I deal with parents almost every day. Parents try to make the best decision they can for their kids, so I totally get it. Both of these options, even though they may be new to the Alberta market, both of these options have been tried and true in terms of safety as well as effectiveness. So not only were they well studied in the initial studies, but they've actually been used extensively around the world. And last season, they were actually used in Quebec and Ontario as well, so even on the Canadian markets. This year, they are recommended by NACI, and they are used in every province. In some provinces like Alberta and BC, they're only covered for the high-risk babies, but they're still there available for parents at cost after they discuss it with their healthcare provider. But the safety and the effectiveness are well shown. They're safe and effective. I think probably the biggest hurdle is going to be price for parents this season.
And finally, what's the one takeaway you want parents to remember about RSV?
Just know that it's out there. It's a risk to the babies that we have. It's a risk to your baby, hard to escape because it's so ubiquitous. It's so common. But for the first time, we do actually have prevention options, and speak to your healthcare provider because maybe this is something that you can provide to your baby this season.
Very helpful. Thank you so much, Dr. Cora, for joining us this morning.
Thank you for having me. Have a good day.
This segment is for informational purposes only and does not replace medical advice. Viewers should consult a qualified healthcare professional about RSV and prevention options appropriate for them or their child.